This week's Ask Dr. Durie is a question that has come up in passing in the past, but I have never really focused on the answer to this question. The question is, do African Americans have an increased risk of myeloma? The answer to this question is yes, and it's quite important to explain the details and the whys and the implications of this. And so it has, based on quite a number of studies over the past 5 to 10 years, become apparent that African Americans do develop myeloma more frequently. The important part to that is that this appears to be because they develop MGUS, the precursor to myeloma, more frequently and at an earlier age. And so there is a susceptibility to MGUS among African Americans, and we don't really know why that is, but they're more likely to develop monoclonal gammopathy of undetermined significance, and also at a slightly earlier age, in the 5 to 10 year range, particularly in men. And so there is this increased risk of MGUS. Now, what we've also learned in the last 5 years or so is that myeloma always develops from a pre-existing MGUS. Now, we don't always document that, and if one looks at this in the opposite direction, only 1% a year of patients with MGUS actually develop myeloma. So all patients with myeloma did have MGUS, but not all patients with MGUS get myeloma. Quite the contrary, in fact. Most patients with MGUS never get myeloma. But this transition from MGUS to myeloma occurs in the same way in African Americans as it does for other patient populations, so for Caucasians, for Hispanics, and for Asians. So the susceptibility or the trend from movement from MGUS to myeloma is the same. So those risk factors are the same. The risk is for developing MGUS, not for having a faster transition from MGUS to myeloma. So this is a very key fundamental point. The other additional point that has been observed is that if you look at the chromosome findings of the myeloma in African Americans, they actually have smaller percentages of the high-risk features. And so African Americans are less likely to have the translocation 414, what we call the T414. They're also less likely to have the 17p-, which means they're less likely to have lost part or all of chromosome number 17. These are two well-known high-risk features. They're more likely to have extra chromosomes, what we call trisomies. And so this is very, very important because this means that actually African Americans are more likely to have a better outcome with treatment versus Caucasians, for example. And this has been documented in several careful studies over the last few years, that the outcomes for African Americans treated with full novel therapy and transplant actually do better than Caucasians. And so this is extremely important because the final point that we've learned is that there is a limitation in the access to full diagnostics and therapy among the African American population in the U.S. And this is a very important concern. African Americans are diagnosed earlier. They have potentially a better outcome. It's tremendously important for the myeloma community to work hard and educate patient communities, doctor communities, experts to be alert and be ready to provide the best possible care for African Americans. To try to raise the level of awareness, there are several projects in progress or in development. Recently, IMF board member and scientific advisor and co-leader of the IMWG, Dr. Vincent Rajkumar, gave a presentation at the National Medical Association meeting, which is the meeting for African American physicians that was held on August the 4th. And at this meeting, Dr. Raj Kumar presented this information about the differences in myeloma in African Americans to help raise this awareness and help this process of getting the diagnosis made early and moving patients towards the very best therapy. And so in the coming months, there will be follow-up meetings under the auspices of the IMWG, the International Myeloma Working Group, and we hope to develop several projects and protocols that would include African Americans so that there can be full access to the very best in care and to achieve the very, very best outcomes.